Good evening, everyone. This is Nurse Eunice with Florida Training Academy. And in tonight's video, we're going to be reviewing practice questions for our phlebotomy examinations. That is right. In the state of Florida, if you are a CNA who's working in a hospital as a patient care tech, you can learn phlebotomy skills also, depending on the hospital that you're employed. So tonight, we're going to review a few questions and we're going to give you about 10 seconds to get started. So, hello, Nemo, hello, Yvette, and hello to all of our other viewers. All right, we'll get started shortly. Hey, Fatima. Oh, so many familiar names. And let's get started in 3 seconds. Right, and if this is your first time here, my name is Nurse Eunice. I am the owner of Florida Training Academy, and I've been away for a little bit, been taking care of my mom. So it is great to see you all, and I'm just going to go ahead and be behind the camera again, but I just wanted to say hey before we get started. So hi, everybody. We do have an online phlebotomy technician program, and you can get more information about it by calling 877-225-7151. You must be located in the United States to take your own online phlebotomy course. In addition to receiving online training, you'll also be partnered at a clinical site where you can get your hands-on training also. If you want to practice skills on mannequins, not on humans, you can also shop at our Amazon store and you can get your phlebotomy supplies. And our website is fltraining.com. Just go down about halfway on the page and you'll see our phlebotomy supplies there. Here we go, everybody. Question number 1. Which vein is most commonly used for venipuncture? Is it the radial vein, cephalic vein, median cubital vein, or femoral vein? And I know somebody was already inputting the answer in the system before we got started. So let's see what your responses are. Oh, Claudia, I'm so proud of you for passing your CNA exam. So Treasure says C, Lynn says C, Marietta says median. And so if you chose C or median cubital vein, you are absolutely correct. So when you look in the antecubital area in the bend of your arm, if you look, you're going to sometimes see a large vein. Remember, veins are spongy. They don't pulsate. You always want to palpate before you attempt a venipuncture, and that's how you're going to make sure that you're hitting a vein, which does not pulsate, versus an artery. So the median cubital vein is the most commonly used vein for venipuncture because it's usually large and well anchored. Question number 2. What is the correct angle for needle insertion during venipuncture? Is it 15 to 30 degrees, 45 degrees, 60 degrees, or 90 degrees? What angle do you want to be inserting that needle? Shelda passed her CNA exam also. I'm so proud of you all. All right, so we have A's, we have a D, we have a lot of A's for question number 2. If you chose 15 to 30 degrees, you are absolutely correct. That angle allows for easier insertion without you touching too much of the skin surface, and it also doesn't make you go too deep. On the next image I have here, whenever you are performing venipuncture or inserting your needle, I like to liken it as a plane that is diving, a plane that's coming in for a landing. So whenever you're trying to enter the vein, you don't want to enter the vein too close to the skin because that means you can take the contaminants from the skin and put it into someone's circulatory system, aka they can get an infection. And if you go at 90 degrees as if you're trying to give an intramuscular injection, you're just going to go straight through the vein. So 15 to 30 degrees is the correct angle for most of your venipuncture attempts. Question number 3. What is the first step in performing a venipuncture or blood draw? Is it A, apply the tourniquet, B, clean the puncture site, C, insert the needle, Or D, identify the patient. What do you want to do first? And we'll reveal the answer in 3, 2, and 1. Eva says D. Julicia says D. Fatima and Treasure say B. We have B's and D's. And if you chose identify the patient, you are right. So you don't want to clean the site until you make sure you're drawing the blood on the right patient. So proper patient identification is crucial to ensure that the correct patient is being treated and to avoid any potential errors. And don't you forget that whenever you are verifying patient identification, it's two patient identifiers. You don't go in and say, hey, is your name Eunice Mathis? Instead, you're going to say, can you tell me your name and your date of birth? And if the person can't tell you their name, they should have an armband. So two identifiers ensure that you're drawing the right blood on the right patient. Question number 4, what is the purpose of the tourniquet in venipuncture? Is it A, to numb the area, B, to make the veins more visible, C, to disinfect the area, or D, to stop bleeding? Why do we put a tourniquet on a person's arm? Let us see. Miss Queen says B. Julicia says B. Chrissy says B, and you all are correct. Yes, it's to make the veins more visible. So the tourniquet restricts venous blood flow, making the veins more prominent and easier to locate for venipuncture. Question number 5. Which of the following is a potential complication of venipuncture? Is it hematoma, hypertension, bradycardia, or hyperglycemia? When you're inserting a needle into someone's arm, what could possibly happen? And we'll reveal the answer in 3, 2, and yes, I see the correct answers coming through. A hematoma could form. And a hematoma is a collection of blood that pulls outside of the blood vessels. So it escapes the blood vessel and pulls under the skin. And it can occur if the vein is punctured or if there is a leakage of the blood into the surrounding tissue. So anytime you see a hematoma starting to form, you immediately, with your gauze, want to begin, of course, remove that needle, take off the tourniquet, but you want to apply direct pressure onto the person's extremity or wherever the puncture site is. Question number 6, why is it important to use the correct order of draw when collecting multiple blood samples? So we have all these vials, right? We call them our vacuutators, and we take them into the room. Why is it important to draw them in a specific order? Is it A, to minimize patient discomfort, B, to prevent contamination of samples, C, to reduce the cost of collection, or D, to speed up the collection process? Why does the order of draw matter? And yes, Eva and Lynn and Julicia and Chrissy, you're absolutely correct. And so the correct response, everybody, is B. We want to prevent contamination of samples. So using the correct order of draw prevents cross-contamination between different additives in the tubes, and it ensures the accuracy of the results. And so this is a little image here, and this talks about the actual order of draw. Look, you always want to start off with your culture tube. So if a patient has an order for blood cultures are always first because we need, once the actual, the needle, there's going to be 2 needles, one inside the patient and one going towards your valve or your vacuutator. We need it as clean as possible whenever we're going to be collecting our blood cultures. So blood cultures go first. And then after that, we have our blue tops. Those are for coagulation studies. We have our red tops, we have our gold tops. Green our lavender, and our gray. And there are a rainbow. There are so many different tubes that you would have to fill. Don't worry, we don't remember half of this. We take notes. So your first time drawing blood, I have these slides available for you on our website, fltraining.com. Halfway down the page, it's going to say free phlebotomy test, and you can download these slides. But that is how it's just after a while you'll remember, but initially you're going to have to use your resources. And let's go to our next slide. So this is a better image of what I just talked about. We have our blood cultures first, and then our blue tubes, our red and our gold, our green and our lavender, and then our gray. That's usually all that I've used in practice. But notice here that we have pediatric tubes. And I think that's important because if you know that a patient's a hard stick, if they have anemia, if they need a blood transfusion, and you cannot collect a whole bunch of adult tubes, call your nurse, call the lab, and see if it's okay for you to use a pediatric tube on an adult patient. And a lot of times they will allow you to do so. Question number 7, which tube color is typically used for a complete blood count, or CBC? And if you don't know it, just guess. We're learning together. Is it A, red tube, B, blue tube, C, green tube, or D, lavender tube? And if you worked in any hospital, what's the tube that we usually get the most? What tube color would that be? And yes, 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 if you chose D, like Lynn and Rose, you know that correct response is lavender. So lavender tubes contain EDTA, which is an anticoagulant used for hematology tests like complete blood counts. So usually you're going to make sure you have a lavender tube whenever you go and you start drawing blood, and then a couple of other tubes of different colors. But your labels also help you. So when you get those labels printed, it will usually tell you the type of lab and the color tube to take with you. So we try to make it very foolproof so that we don't have to stick patients twice and to prevent medical errors. Question number 8, what is the maximum time a tourniquet should be left on a patient? Is it 30 seconds, 1 minute, 2 minutes, or 5 minutes? So we're going to visualize that site. We're going to select the vein. We put that tourniquet on, and she's a hard stick. The veins are not visualized. We're palpating. How long can we keep that tourniquet on before we have to take it off? And if you chose B, 1 minute, you are absolutely correct. So I know what they do in the real world. They keep that tourniquet on for longer than it's supposed to be on. But if it's taking you a long time to find the vein, you're supposed to release it. And so the tourniquet should not be left on for more than 1 minute to prevent hemoconcentration and discomfort to the patient. Question number 9, what should be done if a patient feels faint during a blood draw? A, continue the procedure quickly. B, stop the procedure and call for help. C, lay the patient down and elevate their legs. D, offer the patient water. Let us see, let us see, let us see. Looks like, I hope I'm pronouncing your name correctly. Jonim says B, Fatima says B, Rose. We have a lot of B's. I'm so proud of you. Mariana, for this one, it is not C, and the next slide will tell you why. So here we have an illustration, this isn't real, of a patient who has fainted during a blood draw. The first thing I need you to do is to stop the procedure and call for help. So after you stop the procedure and you call for help, take that tourniquet off, make sure you remove that needle safely, and apply direct pressure to the puncture site. What we don't want you to do is to focus on elevating the legs and you haven't controlled the bleeding. So you get the patient safe, you apply pressure, and once you have help and the bleeding has stopped, that's when we can elevate the legs to send the blood from the legs towards the heart and the brain, and that will hopefully help to alleviate some of their symptoms that they're having. Question number 10. What is the primary reason for inverting blood collection tubes after drawing? Why do we turn them up and down? Is it A, to mix the blood with the anticoagulant, B, to break up blood clots, C, to cool the blood, or D, to aerate the blood? I am so proud of you all. I hope you're proud of yourselves. You're doing so great with this practice test. All right, I see answers all over the board. I have D's, B's, A's. And for this one, we invert the tube because the tubes contain additives. And so it is to mix the blood with the anticoagulant or whatever additive is inside of the tube. So inverting the tube ensures that the blood mixes with the anticoagulant or additive, which is essential for accurate test results. Question number 11. What is the proper way to dispose of a used needle? Is it A, recap the needle and throw it in the trash? B, place it in a sharps container without recapping? C, break the needle before disposing of it? I know no one's going to choose C. Or D, sterilize the needle before disposal? What is the safest for you so that you do not get stuck with a dirty needle? Yes, Fatima, Lynn, Jalicia. So for this one, we don't ever recap, ladies and gentlemen. If you recap, you can get stuck. So you're going to take a used needle with your glove and you're going to pick it up and place it in the sharps container without recapping it. So used needle should be placed directly in a sharps container. Again, no recapping. If you recap it, there's a possibility that you could stick yourself and have a needle stick injury. Question 12. Which of the following is a common gauge size for adult venipuncture needles? And so the gauge is that opening, the part that lets the blood flow through. Do we want to perform venipuncture with a 16 gauge, 18 gauge, 21 or 25 gauge needle? Let's see how much you remember. I see a C and an A and a B. So we have a wide variety of answers for this one. And so the reason why I think a lot of you are choosing B is because in emergencies, when we're talking about intravenous IVs, we'll choose an 18 gauge. But that's for somebody who's going to be receiving blood products, and blood is viscous, it's thick. So we need a larger gauge for somebody who's receiving blood therapy. But for this one, all we're doing is inserting the needle, collecting some blood, and taking it back out. So we need this patient to be comfortable. So for this one, it is going to be, let me go back, it's going to be C. All right, so C is the correct response, a 21 gauge. And it's a little bit confusing because the smaller the needle gauge, the larger the needle. And so a 16 or an 18 gauge, that's not usually used for venipuncture. It's used for blood transfusions, emergencies. A 20 to a 21 gauge is what we'll use for venipuncture, letting blood out, taking it away from the body in an adult. And so if you do a comparison, if you open up a paper clip, that is about the same diameter as for a 20 to a 21 gauge needle. And so again, if you chose C for this one, that is the correct response. A 21 gauge needle is commonly used for adult venipuncture as it is large enough to allow efficient blood flow, but small enough to minimize discomfort. Question number 13. Why should a phlebotomist avoid using a site with a hematoma for venipuncture? Is it A, increased risk of infection, B, difficulty in obtaining blood, C, increased risk of pain, or D, all of the above? So Miss Lucille bruises easily. She's on blood thinners. You're the person collecting the blood, and she has bruises, hematomas on one arm. What do you want to consider before you use that arm? If you chose D, all of the above, you are correct. So using a site with a hematoma can increase the risk of infection, make it difficult to obtain blood. It can cause additional pain to the patient. And the illustration here shows a person who has the bruising, the ecchymosis, which is a sign of a hematoma. Question 14, which anticoagulant is found in a green top tube? Is it A, EDTA? Is it B, sodium citrate? C, heparin? Or D, potassium oxalate? Which anticoagulant is found in a green tube top? And don't get tricked. Only one of the items there is an anticoagulant. So which one is it? Yes, and yes. So everybody, C, heparin is a type of anticoagulant. So green top tubes contain heparin, which prevents blood from clotting and is used for plasma determination. So you will hear about heparin a lot in the medical field whenever a person has had a cardiac issue or if they're at risk of clots. So let's say it's somebody who had a stroke or a DVT. That is when they will get intravenous heparin. So that same medication that we use to thin someone's blood, they put in the green top tubes, and that prevents the blood sample from clotting before it gets to the lab. Question 15, what should be done if blood is not obtained during a venipuncture? You gave it your best stick, you're in there, you thought you had it, you don't get any blood. What do? Do you do A, reposition the needle slightly, B, withdraw the needle and try again, C, apply more pressure with the tourniquet, or D, use a smaller needle? What do we do, team? I have A's, I have B's, I have some D's. You all are everywhere. So if you attempt venipuncture on me and the first time and the needle's still in there and you don't get any blood, don't take it out and try again. You don't want to dig, but you can reposition your needle because you could be right beside the vein. So the correct response for this one is going to be A, don't dig, but you can reposition the needle. So if blood is not obtained, slightly repositioning the needle may help to locate the vein and initiate the blood flow. Question number 16, what is the primary function of platelets in the blood? Is it to transport oxygen? Is it to build the immune response? Is it to help the blood with clotting? Or is it to transport nutrients? So you're collecting blood, you need to know about the components of blood. Like, what is blood? What does it contain? Why am I doing this? So what are your platelets? If you decided that platelets do C, they help with blood clotting, then yes, you know about your blood components. So platelets, also known as thrombocytes, are small colorless cell fragments in the blood that help stop bleeding and to form clots. So if a patient has low platelets, which is, you have to know a lot to be in the medical field, but you as a phlebotomist, if you're going in and you know this patient has cancer, it's kind of like, well, their immune system is low. They probably also have low platelets, which means they're going to be at an increased risk of bleeding. So you have to be thinking of all of this before you go in and just stick someone, because otherwise you're going to be causing injury to the patient and you could cause them more trauma and also blood loss. Question number 17. Which test may require a fasting specimen? Fasting means without food. Is it A, complete blood count or CBC, B, blood glucose, C, prothrombin time or PT, or D, blood culture? Which of those can be done when a person is fasting? And I see the correct answer coming through, Fatima. So, yes, of these, the only time that we would really require a patient to fast is if we needed a blood glucose test. And you'll see this a lot with pregnant women. Whenever we're trying to determine if they have gestational diabetes, they would have to come in and have a fasting blood glucose test. So, blood glucose tests often require fasting to ensure that the results are not affected by recent food intake, such as with a pregnant mother who's at risk of gestational diabetes. Question number 18. What is the most important step in preventing the spread of infection? I need everyone to get this right. All right, so is it A, wearing gloves, B, using alcohol swabs, C, proper hand hygiene, or D, using sterile equipment? The most important step, which one is it? Lynn and Shirley and Fatima, and yes, you all have it. I need you to wash those hands. If your hands are not clean, then the equipment and the supplies you touch will be contaminated. So, proper hand hygiene is the most effective way to prevent the spread of infection in any healthcare setting. Question number 19. Which of the following should be avoided when choosing a venipuncture site? Is it A, areas with visible veins, B, areas with scars or burns, C, areas that are warm, or D, areas that are clean? What do you want to avoid when performing venipuncture? And we'll reveal the answer shortly. Yes, almost everybody has this one correct. And so if you chose D for question 19, you understand that we don't want to cause additional pain or trauma to somebody who has a burn or a scar or a surgical incision, an implanted device in their arm. So we are going to avoid those areas because performing venipuncture, putting a tourniquet on a wound, ouch, can be painful and less likely to provide a good blood sample. Question number 20. How should a phlebotomist label a blood sample? Is it A, before collecting the specimen, B, immediately after collecting the sample in front of the patient, C, before placing it in the specimen bag, or D, after the blood has been analyzed? When do you want to apply that label that has the patient's information, their medical record number, their first name, their last name, their date of birth? You're going to put your signature or your initials and then a collection date and time. When do you want to do all that? And if you chose B, immediately after collecting the sample and in front of that patient, you are totally correct. So labeling the sample in front of the patient immediately ensures that the sample is correctly identified and reduces the risk of error. So I don't care if you have 10 patients. You take the tubes and what you need for that one patient into that room, follow all of the steps and procedures, put their tubes in their specimen bag. And usually in our hospitals, we have a tube system. So you can just, send it off to the lab or go put it on ice or whatever the specimen requires. And then you go into the next room. That's how you're going to prevent errors. So you've got 10 patients, you have 10 individuals. I need you to have 10 individual specimen bags that you've collected in front of your patients individually. Question 21. Which of the following is true about capillary blood collection in infants? And for those of you who don't understand what a capillary blood collection is, it's kind of like an adult, we do a finger prick. But in infants, sometimes the easiest way to collect blood is not through venipuncture, it's through capillary blood collection. So let's repeat the question. Which of the following is true about capillary blood collection in infants? Is it A, blood is usually collected from the heel? B, blood is usually collected from the finger? C, the infant should be fasted before the procedure? Or D, the blood is more venous than arterial? This is an easy one. I think everyone's going to get this one. And yes, everyone did. I am proud of you. So, whenever we're collecting a capillary sample from an infant, we use the heel. If you notice in this image, the blue parts are the safe areas. So, if this represents my heel, or the heel of an infant, you want to be on the lateral lower side. You never want to stick in the center of the heel because that can cause nerve damage, or you can hit a bone and cause an infection. So we go to the lateral sides. Question number 22. Why is it important to allow the alcohol to dry before performing a venipuncture? Is it A, to sterilize the skin, B, to avoid stinging, C, to prevent hemolysis, or D, to ensure accurate results? And for this one, I will take two different answers. So no one's given me the right answer yet. So it says, why allow the alcohol to dry? So the alcohol can sterilize the skin when it's wet. So why do we allow it to dry? So if you chose B or C, I will accept those responses, but textbook response is to prevent hemolysis. So allowing the alcohol to dry prevents it from contaminating the sample and causing the breakdown of red blood cells. So when you look at this image, if you sent a blood sample that looked like this to the lab, you're going to be upset and your patient's going to be upset with you because the blood cells have broken down and they've separated. So we have the serum, we have the liquid part of the blood, and then we have the blood on the bottom. That's a bad specimen. Lab is going to send that back to you. You have to go back and stick the patient again. So you don't want to stick a patient when the alcohol is still wet. Number one, it's going to sting, but number two, it can cause hemolysis. And this is another image and reminder that hemolysis is the medical term for the breakdown of red blood cells, which can release their contents into the surrounding fluid. And whenever it breaks down, that's a bad blood specimen, and the patient's going to have to be stuck again. Question number 23. What should be done if the phlebotomist suspects that the patient has an undiagnosed bleeding disorder? Oh, I'm going to interrupt you. So how do you know if a patient has an undiagnosed bleeding disorder? Let's see. Maybe they have some blood on the sheets. Maybe they have patches, bruises. You can sometimes look at a patient if they're pale. That would be a sign that maybe there's something wrong with the circulatory system. So as a phlebotomist, you got to go in and start assessing these patients before you start sticking them. So a person who has an undiagnosed bleeding disorder, what do you want to do? Do you want to continue with the procedure as planned? Ask the patient to see a doctor first. C, use a smaller needle to minimize injury. Or D, notify the patient's nurse or physician before proceeding. So you have worked your way up to LabCorp and you are a mobile phlebotomist and you have to go stick somebody who has really thin skin, who has a diagnosis of cancer, who has ecchymosis or bruising all over their body, and you should already know that this person's about to bleed on you. So what do? And if you chose D, you are a safe provider. Yes. So D, notify the patient's nurse or physician before proceeding. If the bleeding disorder is suspected, the pharmacy should inform the medical team to ensure the appropriate precautions are taken. And what I have here is it's like a surgical wrap. It's called Coban. That's one of the ones that we use. So for a person who doesn't have any issues with bleeding, you can put a Band-Aid. You can put a 4x4 folded up. You can put a 2x2. But if I know this person has an issue with bleeding, I'm coming in with the big guns. I'm coming in with some Coban. And this is wonderful because it doesn't stick to the skin. It sticks to itself. So you can put your 4x4 down, your folded 4x4 or your 2x2, and then you wrap the Coban around it. It's going to be easier for the patient to take off later. It won't cause any injury to their skin, but that's going to apply pressure and decrease the chances of them bleeding. I'm sorry, I got distracted by Tripty. Hi, I want CNA recent video. Tripty, tonight we're on phlebotomy. I'll see you on Wednesday with CNA. Question 24. What is the purpose of using a syringe in phlebotomy instead of a vacutainer, instead of the tube that sucks? Why use a syringe? Is it A, to increase the speed of blood collection? B, to control the suction pressure and to prevent vein collapse? C, to collect larger volumes of blood? D, to reduce the risk of infection. So why do we use the syringe technique instead of a vacutainer? So for this one, it's not D, but so you're learning something new this evening, and I love it. For this one, it's going to be B, to control the suction pressure and prevent vein collapse. So in the image, we have someone using a syringe with the a needle with a syringe in order to withdraw the blood. So they pull back on the plunger. But if they pull back on the plunger really gently, it's going to allow the blood to flow out slower, and it's going to be less likely to collapse that vein and stop the blood from flowing at all. So syringes allow the phlebotomist to manually control the suction pressure, making them ideal for use with fragile veins. And we're not done yet. We have one more question. Just a reminder, in case you came halfway through the video, my name is Nurse Eunice. I'm the owner of Florida Training Academy. And if you stayed this long, go ahead and like the video, and also don't forget to subscribe. If you're interested in taking our online phlebotomy technician program, our course, you can call 877-225-7151. And now we're on our final question, team. You all are a group of awesome caregivers. So question number 25, what should a phlebotomist do if they accidentally puncture an artery during venipuncture? Oh, that means you didn't do your proper steps. You didn't palpate, because if you palpate, you'll know that veins are spongy. They don't pulsate. So if you accidentally hit an artery, what should you do? A, proceed as usual. B, apply pressure for a longer time. C, withdraw the needle and apply immediate pressure. D, ignore the mistake and continue with the procedure. Tiffany, I have to do my nursing videos for my nursing students before I do CNA videos. I'm sorry. I know I need more help. So if you all know a nurse, a seasoned medical assistant who would like to join Nurse Eunice's team, please have them email me, reach out to me, because I do need more help so I can get these videos out to you all. And if you chose C, you are correct. So the reason why B wasn't correct is because you don't want to apply pressure with the needle still in there. So C is correct. You're going to withdraw the needle and immediately apply pressure, and you're going to apply pressure for a longer time, because an accidental arterial puncture, blood can start squirting out if the blood doesn't stop If it doesn't stop, there are other techniques you can use. So in addition to direct pressure, we talked about that cold band, that wrap, and direct pressure. You can also elevate the extremity. If you bring the extremity above the level of the heart, that should slow down blood flow too. But usually for an arterial bleed, you may have to hold pressure for 5 to 10 minutes or until the bleeding stops. So you all, if you have stayed this long, I appreciate you. You all know how I just think the world of you all, because I know that you all are our future, and I look forward to seeing you all in the next video. And my goal is to be on here on Wednesday. So tomorrow I'll be at the office, but I'll be back on Wednesday with a CNA video. So you all, thank you for watching. I love you all. I pray for you all, and I wish you much success with whatever your goals are. You have a great night, everybody.